And is your camera on? Okay, we'll get started, everybody. So thank you guys for coming. So I just want to give a little intro to MSGR before we start. It's for people to be able to express both their research interests, but also any of their personal passions to the general student body. And every medical student presenter will be introduced by a faculty mentor that they've worked closely with. And these MSGRs are every third Tuesday of each month at noon. And sometimes on the first Tuesday, but that's scheduled on a month-to-month basis. And for this whole school year, all of MSGR has been hybrid, so it's been both on Zoom and in person. You can go to that website for our most recent schedule. And we also record all of these talks, so we'll be uploading this to YouTube after, and if you've missed any of them, you can also go to that link to watch. And with that, I'll let Dr. Habash introduce our speaker, Hendrik.
Thank you. Hi, everyone. It's great to see everybody here, and thanks for the invitation to do this. One of the things that I can say about Hendrik is that he lives what he believes. He is passionate about his own health, and that'll be very obvious as you listen to him. About 23 years ago, Ohio State had about, 20 to 30 professors from medicine and from around the campus who were also of the same mind. And they came together every week at 7 a.m., as Dr. Mariana Klatt likes to tell the story, to figure out how to create something here on the campus that was like other things sprouting up around the country. And that is a center for integrative medicine and integrative health. And it took a few years, but in 2005, is when the clinic actually started here on the campus. And we have providers, and Hendrik will talk about that. But their passion and their courageousness is very much like what you'll hear from Hendrik. And that is the belief and the use of all different kinds of therapies to help a person with their health. They were very concerned about patients who were passively worrying about their health and not doing anything active. So as you'll hear today, because he is exactly of that mind, and he's done things ever since he's been here to bring that forward. For instance, he's been a leader in the student interest group in integrative medicine for a few years, I think. He's also used the capabilities and been mentored by our former medical director, Anton Borja, and a former physician who's now out in Salt Lake, which is where Hendrik is from, Salim Sheikh, to think about and to learn about lifestyle medicine. As well, he is involved in the advanced competency in integrative medicine this year as a fourth year. So I think you're going to find some really powerful things about how he's brought his passion, learned more, even beyond the beautiful coursework and curriculum that you have here at the college, to extend that to understand how to help patients take care of themselves using many resources. Okay, so welcome, Hendrik.
Thank you so much, Dr. Habash. That's really kind words, and maybe more than is deserved, but I'll take it. As Dr. Habash said, today's talk, as I hope many of you know, is about integrative health. So we'll kind of learn a little bit about what that means and some of the modalities that fall into that category. So briefly, who am I? So I'm Hendrik. I'm that guy. I'm trying to get a lot of mileage out of this because it's a whole big thing, but it's a good picture and I'm trying to use it. So I'm a fourth year here at Ohio State. I'm applying into family medicine. We've got match in about a month, so hopefully I end up somewhere in family medicine. For a long time, I've had kind of a personal interest in health and wellness. I've really liked to exercise and eat well and even before medical school, started volunteering at a free clinic and was running their wellness program. And that interest in kind of keeping myself well and helping other people learn how to do so for kind of low cost has been something that's important to me, and I think is a really important part of treating a lot of like chronic disease that we have here in America. And after entering into medical school, I found myself growing more interested in this thing called integrative health, because it really overlaps quite nicely with my interests in health and wellness. And so I started to get more involved in what was available here. And so like Dr. Habash said, I ran the students for integrative medicine interest group for a couple of years. I was in charge of the acupuncture clinic at Columbus Free Clinic for a couple of years. I'm in the advanced competency this year, and I'm also helping to facilitate mindfulness in motion, which is a mindfulness course offered to students and faculty members here. So if you see emails about that, is a brief plug for that. It's a great course and really helpful stuff. So just to kind of go over the goals of the talk, I want to briefly define and describe what integrative health means, both to me and more generally. Describe the services of integrative health that are available here at OSU that both you guys can take advantage of, but you can also recommend to patients. And then go over a few modalities, including the indications and evidence, as well as some other details about them, so that you guys can feel a little bit more confident in knowing what they are, but also when you or a patient might be able to make good use of them. So what is integrative health? So National Center for Complementary Integrative Health describes kind of three terms. So briefly, I'll say, if you don't really have much exposure, things that fall into this category are like acupuncture, like we've mentioned, chiropractic, naturopathy. So just to kind of give you like a framework as we start to describe like how it all fits together. So NCCIH describes first this alternative medicine, which is basically defined as non-Western medicine. So things that we don't typically learn about that are used in place of Western medicine. So that would be like if a patient, didn't go to see their primary care provider, but instead went only to a naturopath. Complementary medicine tends to describe non-Western medicine that's used as a complement to Western care. So that would be like a patient who does go to see their primary care provider for, say, hypertension treatment, but when they hurt their back, they have a chiropractor they like to go see. And then integrative health is kind of this combination, this coordination of both Western and non-Western medicine to really try and address all of the patient's needs. So that would be like you have a primary care provider that provides, blood pressure medication for the patient, but the patient comes in and they say, I've been having a lot of back pain and I don't know what to do about it. And then the primary care provider says, well, have you ever considered acupuncture, or have you considered chiropractic, or have you considered other complementary modalities? And they really try and build that into the whole care picture to help care for all of these different aspects of the patient. Importantly, integrative health is holistic, so it looks at the patient as a whole person. It tries and meet their needs kind of physically and emotionally and mentally and spiritually. It's patient-centered. It really kind of puts the patient needs and desires at the forefront and kind of tries to align with them. And it, importantly, I think especially for us kind of going to this big academic center, it should be evidence-based. And so that's kind of what I want to reinforce today, is that there is a lot of evidence behind these integrative practices that you can really use to help you make decisions and feel like you're making wise decisions. So you can kind of break integrative health down into a few different ways. So on the far right, you have kind of natural products, like things that you put into your body, and then mind and body practices, things that you do with your body. And then you can further kind of categorize that as nutritional, psychological, physical are kind of the main categories of integrative health. And so you can see they kind of fit nicely together and into these different things. But an important thing to consider is that a lot of these practices meet multiple needs. So for example, yoga and Tai Chi are both excellent movement techniques to work on balance, but they also help you practice mindfulness. So just to describe a few of, say, the nutritional things, common examples you might find are like special diets to meet patient dietary needs, vitamins and minerals, supplements and probiotics, you can see there in the nutritional section. Psychological practices include mindfulness, meditation, physical things like yoga and Tai Chi, but also physical medicine techniques like osteopathy, acupuncture, chiropractic, and massage. So I get the impression if you're here that you probably are already interested in caring about integrative health. But if you need sort of more reason to, it is becoming quite common. So in 2012, which is admittedly a little while ago, 33% of Americans surveyed, and this is a big national survey, had tried at least one integrative approach in the last 12 months. So that's kind of a lot of people. And it's being more and more frequently recommended by medical providers. So in 2015, it was used or recommended in 8% of office visits compared to 2% in 2005, so 4 times as frequent. And there is growing support for these practices in professional medical guidelines. So our most recent clinical practice guideline for chronic pain notes that a lot of integrative techniques such as acupuncture and manipulation are non-inferior to other first-line treatments. So it kind of gives this table and it says, you know, you can consider like ibuprofen and Tylenol, or you can consider acupuncture and chiropractic, and you should compare those about equally and kind of work with your patient to see which works best for them, but none are inferior to the others. So that's pretty great. 2017, the American College of Physicians Clinical Practice Guideline for low back pain recommends several integrative techniques as appropriate non-pharmacologic interventions, along with, say, heat and ice, physical therapy, kind of your other standard non-pharmacologic interventions. So there is a lot of growing appreciation of these practices. Outside of the data, I think there are other reasons to care about integrative health. So as mentioned before, it really is patient-centered, and it is an important way that you can help build rapport, especially with patients who have struggled to find treatment in the normal medical system. There are a lot of diseases and conditions that we just don't really have great treatments for. Things like fibromyalgia, things like irritable bowel, where they've kind of tried everything in the normal medical system and really haven't found relief. And so being able to recommend these sorts of things can really give people another option to approach these really challenging, especially like psychosomatic conditions. Or for people who may have an issue with pharmacotherapy, either sort of a personal issue of not really being into it, or maybe they have a particular indication or disease that may prevent them from taking NSAIDs, right? Maybe they have a kidney injury that kind of puts them at risk for NSAID use. And so you could consider other like pain relief modalities that are not pharmacologic in those cases. And then kind of a personal point, I feel like for a long time, and continues to be the case, healthcare in America is really reactive. So we treat people who are sick when they are sick, and we really focus on these treatments that we have developed. And I think that that does a disservice to the people living in America, because so much of the disease now is chronic, and it is things related to lifestyle. And so by looking at integrative health practices, we can really look at techniques that help emphasize diet and mental wellness and physical activity and caring for the whole patient, and really incorporating other cultural practices in a way that is respectful of other people's backgrounds and other people's rights to sort of live a healthy life outside of just coming into the hospital or being treated for disease. So let me talk to you a little bit about integrative health at Ohio State. So the main integrative center is at 2000 Kinney Road. I've included the number there just in case you want to call it. It looks like this. It's like just barely south of Martha Morehouse. If you've ever been to Martha Morehouse, it's like maybe 1 or 2 driveways south of that. If you take a left turn coming south, then you'll encounter this building. Integrative Health at Ohio State is, we're part of this consortium of about 75 academic medical centers that have integrative medicine services, and ours is pretty robust. So if you were to think about treating a patient and you wanted to consider integrative medicine for them, the way it typically works is that in the outpatient setting, you would put in a referral in Epic, and you just basically go into the orders and you type integrative medicine and it pops right up, and you order that for the patient, and then the integrative medicine folks can reach out to them. And typically, unless you were to suggest a particular modality, right, maybe you just think this patient could benefit from something, I'm not quite sure what, they would have a consultation with one of the integrative medicine clinicians. There are a handful of doctors at the Integrative Medicine Center who are fellowship trained in integrative medicine. And so they meet with the patient, they kind of talk about the patient needs and desires and use that information to decide which of the services offered at the Integrative Health Center would be best for the patient to use. There are a handful of services that the patient can self-refer to, including massage, chiropractic, and acupuncture. Many of these are covered by insurance. Some of them are also covered by self-pay. And so there's a little bit of dancing to figure out exactly which you fall under, but many are in fact covered by insurance. So there are a number of services offered. They do acupuncture, Ayurvedic medicine, chiropractic, mind-body therapy, functional medicine, which we'll talk a little bit about, in addition to nutrition counseling, lifestyle medicine, osteopathic manipulative treatment, therapeutic massage, as well as group classes that are offered at the center in Tai Chi, Qigong, meditation, yoga, kind of movement and mindfulness things. And I don't think this is an exhaustive list. We have a lot of integrative medicine capabilities, many of which are really cool. I mean, they're all pretty cool, but a lot that I think you would be able to find use in either yourself or for patients in the future. So with that being said, we don't have all the time in the world, and I really want to just cover 3 today. These are things that I am either aware of myself, kind of have a personal interest in or experience doing, or think it's a good point of consideration for medical students. A piece of integrative medicine that has been challenging for me is feeling like I have evidence to discuss these things, especially with providers, but also with patients, because a lot of times you bring up the concept of, have you thought about acupuncture? Have you thought about osteopathic manipulation to especially older physicians? And they say, oh, they either don't know about it or they just don't know what the evidence is. And they say, oh, I don't think that would be useful for the patient, or can you tell me what it's useful for? And outside of just sort of knowing a little bit of like, well, I think it's good for low back pain, I feel like for the last couple of years, I didn't have a great understanding of what it really was useful for, because there are definite indications and there are definite bodies of evidence for these things. And so I felt like it would be a good use of time today to give you guys sort of an understanding of what are some of the modalities and indications that are really pretty robust, so that you can come out today saying, okay, I may not know everything about acupuncture, but I at least know that it's good for like these 3 things. And I can confidently say it's good for these 3 things. And I think that's just an important part of understanding these. So without further ado, we'll jump right into these. So acupuncture is an ancient form of treatment, very old. And it is the placement of very fine needles, finer than hypodermic, into the skin at various points along the body. It's been around for maybe 3,000 or 4,000 years, but was first described in very good detail and is recorded in the text, the Inner Classic of Huang Di, which we think is about 2,100 years old. So, we have good descriptions of acupuncture that persist today from 2,100 years ago, which I think is pretty cool. Traditional acupuncture theory says that there is this life energy called qi, and you see this in a lot of, especially Eastern medicine, but qi that moves through the body left and right, up and down, all over the place, but generally moves through set paths along the body called meridians. There are these channels along which qi can run to get everywhere it needs to go. And either as a result of disease or as a cause of disease, qi can become stagnant. It can get stuck at particular points along the body. And so acupuncture is designed to, in the placement of these needles, relieve the obstruction of qi and help it flow more. And the thought traditionally is that that helps ameliorate either the disease itself or the symptoms of the disease. And so we can see in this image in the bottom right, all of these little dots are acupuncture places, and then the sort of dim, dull lines that they run along, those are meridians. And so you might place needles along a meridian to treat a particular disease. That being said, we have a number of theories proposed in kind of Western understanding of acupuncture for how it might work. There aren't really unifying theories. There are some suggesting that it may impact sort of neurotransmitter release, something we call gate control, in the treatment of pain. There are others suggesting it improves circulation and lymph flow through the stimulation. Others suggesting that it sort of helps release fascia, and in some ways that can also improve sort of, muscle movement, relieve pain, improve sort of general mobility. But none of them seem to explain everything that is going on. And so unfortunately, we don't really have this robust theory that unifies all of the things that acupuncture has been effective for. So I'm going to talk a little bit about research, but I want to bring up a few points before we get into it, just things to think about for any research, but particularly for some of these integrative research and particularly for acupuncture, because there are some points as we consider the research that are kind of interesting and unique. So question number one is, how do you blind an acupuncture study? Because people typically will know if you're putting needles in them, right? And so it's kind of tricky to know exactly what is an appropriate control or placebo. So sometimes it's against nothing, which is maybe not the best, because we know that placebo effect is real. We've known that for a very long time. And so comparing it to nothing may not be the most effective. But what is a good placebo for putting a needle in somebody's body, right? It's sort of an interesting question. And so some that have been proposed and are often used in the literature are things called sham acupuncture. So the idea being that you are either placing a non-penetrating thing like a toothpick at points along the meridians. So you're sort of stimulating that stimulation in the places you would normally do it. Or you would put in needles, penetrating needles in points that are not thought to be effective. And so that's sort of another way to compare. Each of which is sort of, questionable about whether that really is a perfect placebo, but is better than nothing, certainly. And then often it's compared to usual care, right? Because that's sort of the thing we're interested in knowing is, how does this compare to, say, NSAID use or physical therapy? Second point, and harder, is how do you double blind an acupuncture study? So obviously, if you have like a white pill that does something and a white pill that does nothing, like it's pretty easy to like have a physician give those out and they won't know what's what. But if you're having an acupuncturist say like needle these points that are effective versus needle these points that aren't effective, it's going to be a lot harder for them to be blinded, because they kind of have a good idea from traditional theory about which of these points are indicated for a condition and which of these points are not. So it can be very challenging to do this aspect in acupuncture study. And then finally, what are we looking for in terms of an outcome? What are we looking for in terms of efficacy, right? I think ideally we want something that's better than nothing. Does it need to be better than placebo? I think hopefully yes, but that's a good question. Does it need to be better than our gold standard treatment or better than current treatments? Or does it need to be as good as current treatments? If we're just looking for alternatives, maybe just being like as effective as, say, ibuprofen is good enough, or as effective as physical therapy is good enough. Ideally it's better, but we're just looking for kind of tools in the toolkit. So with these things in mind, let's kind of jump in. We're going to go over just a few kind of bigger studies. I just selected like mostly reviews and meta-analyses. In 2020, there was a Cochrane review of 33 randomized control trials looking at acupuncture in low back pain. And in this analysis, they found similar efficacy to sham treatment for pain reduction, greater efficacy than no treatment in pain relief and functional improvement compared to usual care, which was variable between the trials, but usual care, no significant difference in pain, more effective in the short term in improving function, but that kind of deteriorated over time. And a similar incidence of adverse events between all comparison groups. So I think this already does a nice job of illustrating some of the points I wanted to get at before, where we're sort of similar in efficacy to a placebo, but it's a placebo, how good a placebo is it? More effective than nothing, obviously, is good. Similar to usual care. And I think that's an important point, is that it may not be better across all domains, but we have something that appears to be similar in treatment ability to the usual care that we would prescribe to people. And lastly, it seems like it isn't any more dangerous than anything that we're doing right now. So important points to consider. A 2018 meta-analysis with a few more randomized control trials found that it did significantly improve pain compared to no acupuncture and sham acupuncture. They looked at a few different kinds of pain, and this included low back pain. And interestingly, they found that after the treatment was provided, that the effects of the treatment persisted with relatively little fall off for about a year. So significant pain reduction for about a year. And the effect size of acupuncture for these treatments was greater than that shown for NSAIDs versus placebo. So I think for low back pain, we can pretty comfortably say that acupuncture is pretty effective. In some cases, maybe more effective, but at least as effective as what we do in kind of Western medicine. For another common complaint for it is kind of osteoarthritis and knee osteoarthritis in particular. And so in 2010, Cochrane review looking at several joints, they found that there was a statistically significant improvement over sham treatment, but using their clinical significance, there wasn't really, like, you wouldn't see a clinically significant difference. They did a lot better than people on the wait list, but they also note that very few treatments that we use for osteoarthritis actually meet their definition of clinically significant, including things like NSAIDs. So for knee osteoarthritis, acupuncture does seem to be pretty effective. And in 2017, we see sort of similar results, reduction in pain on 2 different scales at up to 3 weeks afterwards when used as an adjunct, and similar or improved efficacy to a lot of kind of usual care modalities. They do note there was kind of significant heterogeneity between the studies, but they did find a pretty consistent results, and then no difference in safety. Slightly different one here is migraine. So in 2016, we saw significant improvement in migraine frequency versus nothing and versus sham control, and a significant improvement in frequency versus common prophylactic drugs like amitriptyline. Although that improvement over amitriptyline was not seen at 6 months. At 6 months, it became as effective. There wasn't a significant difference. And actually, acupuncture participants in the trial were less likely to drop out due to adverse effects. The medication was more burdensome to the patients than the acupuncture was. And then finally, in cancer pain, acupuncture plus conventional pain relief medications was more effective than medication alone. They noted that acupuncture was not more effective than pain medication. There was not a significant difference, which again says that acupuncture seems to be as effective as kind of traditional pain relief modalities in treating cancer pain. So this is all pretty cool. I mean, we've got some kind of classic bread and butter primary care cases. We've got migraines, which are always challenging to treat, and then cancer pain, which is just such a difficult concept. And these are all relatively effectively treated by acupuncture. I want to talk a little bit about ear acupuncture, also called auricular acupuncture. Interesting because you only insert needles into points on the ear. So these are kind of some of the points and places on the ear. There are a lot of points. It's interesting in the sense that if you look at acupuncture diagrams of the ear, it looks a lot like, I don't know if you guys have seen the homunculus of like sensory and motor stuff on the brain for kind of how our brain controls our movement, but it's very similar on the ear, that you can draw sort of a section for the arm and a section for the leg and a section for different organs. Recent meta-analyses suggest that auricular acupuncture may be effective in treating both cancer pain and in chronic back pain. So pretty cool that you can do that just by putting needles into somebody's ear. And then I also wanted to touch briefly on something that is also quite interesting called battlefield acupuncture. So acupuncture is being trialed in the military as an alternative to medication in treatment of pain when people are out in the field. And so you can kind of see in this bottom image, there are these little seeds, we call them acupuncture seeds, little metal dots, and they're basically tiny needles that you can like put in place and leave in place for several days at a time. And so what they're finding is that acupuncture may be an effective treatment in pain for people who, for whatever reason, out in the field of combat may not be able to take pharmacologic medications. So in terms of resources for you guys, there are a couple of places that I like as I've kind of been learning about it. The NCCIH, as we've already talked about, is really great for kind of summary information. They had a lot of the reviews that I was kind of discussing are available there, as well as for some other conditions. David Wong is one of the acupuncturists here at Ohio State. He's trained in Western medicine as well as in traditional Chinese medicine, and he's been an acupuncturist for a long time. He has a clinic that he also runs not here. He has his own private clinic, and he's made this website called Wong Acupuncture to support that clinic. And it has a lot of great, like, frequently asked questions and other resources for other conditions for which acupuncture can be used that maybe aren't quite as robust as some of the stuff I was covering, but there are a lot of conditions and data supporting it. If you are interested in either providing acupuncture for a patient or interested for yourself, you can go here. It may not be covered by insurance, so something that we recommend, especially at Columbus Free Clinic, is a place called Urban Acupuncture. They do sort of a pay-as-you-can model, so they have a suggested rate if you can manage it. If you can't, you can still get their services. So it's really great for people who may benefit from acupuncture, but who may not have the means to pay for a self-pay appointment. And then if you're interested in learning how to do acupuncture, Columbus Free Clinic performs auricular acupuncture on the first Thursday of every month. They do relatively regular trainings, so you can kind of keep your eye out, keep your ear to the ground to see if they're having a training. I had a really great time working with it. You might recognize that face up there, learning how to get needled when I was in my first year of medical school. So with that, we've kind of covered acupuncture. I want to touch a little bit more briefly on osteopathic manipulation. OMT, osteopathy, is a method of treatment performed by doctors of osteopathy, or DOs primarily, that aims to treat conditions through manipulations of bones, joints, and muscles. And so a lot of it is musculoskeletal. Sometimes they'll use it for other things. There are a number of techniques that osteopaths will use. Some of the big ones are muscle energy, strain, counter strain, soft tissue therapy, and spinal manipulative therapy. So the first three are all kind of joint and muscle modalities, and they're things that you might also see massage therapists or physical therapists kind of making use of techniques like these. And then SMT, spinal manipulative therapy, is more in line with what a chiropractor does. So osteopaths kind of do a little bit of all of it. Osteopathy has been demonstrated as useful in acute low back pain. They saw in 2017 meta-analysis statistically significant, clinically modest, so not huge, improvements in pain and function at 6 weeks with spinal manipulation. Again, similar clinical benefit to NSAIDs. A lot of heterogeneity, and this tends to be a problem with kind of physical medicine studies, is just, you know, if you're an expert in, just like people do their physical exams differently, if you were trained at different places and doing a physical medicine intervention, you probably learned how to do it differently. And so it's very hard to standardize these studies, but what they were finding is still significant improvement. Main adverse effect that they saw in this trial was transient discomfort. So basically people would just say, oh, it kind of hurt when you were doing the treatment, but afterwards they found that their overall pain levels were reduced. In terms of chronic low back pain, Cochrane review demonstrated statistically significant but not clinically relevant improvement in pain and function compared to other interventions, but of a similar level, again, without any significant harms. So compared to physical therapy and a lot of kind of our standard ibuprofen, Tylenol, it was about as effective in treating chronic low back pain. Neck pain, thoracic manipulation and mobilization improved pain and function in acute and subacute neck pain compared to inactive control. Multiple sessions, so seeing the provider multiple times for cervical manipulation and mobilization was more effective for pain and function compared to kind of our standard pharmacologic interventions at basically every long-term at every term follow-up point. They did note some very rare and devastating adverse effects associated with cervical manipulation, but not with mobilization. And just to clarify, manipulation is kind of like back cracking. It tends to be like interventions of cracking bones. It's more bone focused. And then mobilization is more like improving mobility of joints and muscles. And so they found that that was a little bit safer in terms of these adverse events. And we'll talk a little bit about what those were. There's also some evidence for headache, and then oftentimes OMT will be used for pediatric conditions. We have an OMT provider at OSU who does a lot of work with kids. There's a little bit more limited data, but I think if you find that you like your OMT provider and it's helpful to your kid, then certainly worth considering. So these adverse events that were described are admittedly pretty scary. So they found vertebrobasilar injury, so injury of arteries in the back of the neck, lumbar disc herniation, cauda equina, and death. Very rare, but were reported over the course of all of these things. And so for a lot of these, you just have to, OMT providers are doctors too. So you have to trust a little bit that they're going to know what they're doing. They're going to take a good patient history. But as you're considering whether you want to maybe do a referral, you got to kind of look at your patient, like, do they have a history of, say, artery dissections? Do they have a history of osteoporosis, of bone cancer, things that might make them a little bit more susceptible to damage with physical medicine techniques? This was a nice article, this Smith article in American Family Physician that a lot of my information came from. It does a really nice job of just saying, like, here is what it's indicated for. So if you feel like you need a refresher, that's kind of a good place to go. And then if you're interested in learning more about how to actually do osteopathic manipulation, I've had the opportunity to learn from some of these folks. The DO school at Ohio University in Dublin will occasionally do classes that do have, a fee associated with them, but you can go out for a weekend, kind of learn osteopathic techniques. You don't have to be a DO to practice osteopathy or to practice OMT. If you have learned enough as an MD, you can practice it yourself. So if you have an interest in learning, here's some opportunities while you're here in medical school. Finally, I want to touch a little bit on functional medicine and dietary supplements. This is an area where I don't have as much personal experience learning, but I think it is something that's important as medical students to kind of be comfortable with, like, what are these things? What are dietary supplements? Because, we learn that we're supposed to ask about them, but we don't really, I feel like we don't know why we're asking about them. We don't know what to do with them. So functional medicine, as defined by the Institute of Functional Medicine, is a systems biology-based approach that focuses on identifying and addressing the root cause of disease. Now, I don't find that to be a very helpful definition. So you can maybe get a little bit more from the image on the right. So the idea of functional medicine is that bodies are complicated and there are a lot of biological metabolic processes going on. And these things, when functioning and dysfunctioning, can either lead to disease or be affected by disease. And so in the image on the top one, we have depression, which is obviously a complicated disease, and as illustrated here, can be impacted by a lot of different things. So, you can have primary depression where it is maybe an issue of neurotransmitters, but it can also be worsened by having low thyroid hormone. It can be worsened by certain vitamin deficiencies. It can be worsened by, emotional and psychological effects of other diseases, as well as the actual disease processes themselves. So they all contribute to this picture of clinical depression. Now, in the bottom one, we also have conditions such as inflammation that we know contribute to a lot of different diseases. So if someone has a lot of chronic inflammation, say they have, an inflammatory disease like rheumatoid arthritis or sarcoidosis, or, we're learning a lot about chronic stress as being a chronic inflammatory cause. So people that may have really high levels of underlying chronic stress, they can contribute to and exacerbate a lot of really common diseases, heart disease, depression, arthritis. And so functional medicine really takes all of this information together and tries to look at a patient's behaviors and their needs and their illnesses, and really try and build a plan for the patient in terms of behavioral intervention and psychological intervention and nutritional interventions to try and ameliorate some of these issues. So frequently, in my experience, and I think in other people's experience, a takeaway from a functional medicine appointment, something that you can give to the patient, is dietary supplements, which, as I said, I feel like dietary supplements are kind of like the bane of a medical student's existence, because you learn to ask, what medications are you taking? What vitamins are you taking? What supplements are you taking? And in OSCEs, patients never say they're taking any supplements. And so you're like, great, I asked, check the box. In real life, if someone lists 5 supplements, you're just going to kind of file that away somewhere. Like, I feel we learn so little about what supplements actually do that you get the information and you just don't know what to do with it. So there are important considerations as you're thinking about supplements. And what I want you to take away from today is, even if you don't know everything about it, I'm hoping I can give you at least some resources. So things to think about in terms of supplements are, you can buy them over the counter. So unlike, medications that we prescribe, obviously they're a little harder to get your hands on, but supplements you can really get anywhere from anybody. And so it's a lot easier for patients to get their hands on things that are good, but maybe things that they don't know as much about in terms of efficacy. There's a lot of variability in how efficacious supplements are, even if it's the same supplement from different providers. There's variations in quality, there's variations in dosage. There's variable evidence for different supplements. And then a lot of these supplements can have adverse effects. So they may not be well written on the bottle, very fine text, or they may have interactions with drugs. I feel like we have all been asked to memorize what induces or inhibits CYP450, and on that list is a handful of supplements, right? And so there are things that patients will be taking that you didn't prescribe them that may have an impact on their health. And it's worth at least understanding that that's the case as you kind of try and just decide how to advise them on using these things. So I just wanted to cover 3 actual supplements today: fish oil, probiotics, and ashwagandha, one of which has a lot of data. The next one has a fair bit of data, and the third one is like something that we just don't know that much about here, very common elsewhere in the world. So fish oil is probably most well studied in cardiovascular disease. You'll see people taking it when they're also on a statin or when they're also on blood pressure medication. There have been some really big studies, meta-analyses in 2019 and 2020 with well over 100,000 participants, found reduced risk of several cardiovascular disease outcomes. The 2019 one, they saw more significant reductions in heart attacks, coronary artery disease, cardiovascular disease as a whole, in a dose-dependent manner, right? Suggesting that more fish oil is better for these things. No association with any kinds of strokes, which is kind of interesting considering that they're all sort of cardiovascular issues. In the 2020 study, they found a reduction in serum triglycerides, which may or may not really be clinically significant. Some reduction in cardiovascular outcomes, but then fewer than were seen in the other study. There are a lot of data looking at other diseases that really don't have quite the same robustness of outcomes or consistency of outcomes. So infant health and neurodevelopment, it's kind of mixed in terms of whether it's useful or not. Handful of cancers, Alzheimer's, dementia, macular degeneration, dry eye, rheumatoid arthritis. It's also been examined for depression, inflammatory bowel disease, ADHD, and other neurological disorders, childhood allergies, and cystic fibrosis. There is evidence for, there's some evidence maybe against. It seems like the most robust is for cardiovascular health. So I think you can take away from that if a patient has known cardiovascular disease, you could suggest fish oil for them. They can, suggest it for themselves, and you could feel pretty comfortable saying they should take it or wouldn't be harmed by taking it. And to that, studies suggest that it is safe at doses up to 5 grams per day. It may well be safe at higher doses. This was just kind of the consensus, that it didn't seem to cause any issues at 5 grams per day. And it's thought that it may have antiplatelet effects at higher doses than that. There were pretty high doses where they were seeing antiplatelet effects, kind of similar to aspirin. And so while it may not really be clinically significant, if you have patients that are already taking aspirin or are taking anticoagulants like warfarin or some of those like factor 10 inhibitors, then it may be worth at least considering whether fish oil is appropriate for them. Probiotics, I feel like we've all heard about probiotics and none of us know if they're useful for anything. So they are useful for a handful of things. So antibiotic associated diarrhea is kind of the one with the most robust data, right? So if you have a patient in the outpatient in the hospital and you're putting them on antibiotics, particularly taken by mouth, it can be beneficial to also give them a probiotic to help prevent diarrhea that is a very natural part of taking antibiotics. In 2015, they found a reduced risk of diarrhea in both adults and children with this particular strain, Saccharomyces boulardii. They noted that the doses in the trials were mostly between 250 milligrams to 500 for children, and then 250 to 1,000 for adults. That can be kind of a challenging thing because they're sometimes dosed in milligrams, they're sometimes dosed in what's called colony forming units. And those are not always consistent. So another challenge of trying to figure out probiotics is exactly how much is appropriate. In the 2016 meta-analysis, there was a reduced risk of diarrhea in adults under 65. They didn't see it in elderly adults, but they did see it for adults 18 to 64, with basically all the lactobacillus species that they looked at, again with S. boulardii, and then with a number of bifidobacteria species. So that suggests that kind of just generally taking probiotics can be effective for antibiotic-associated diarrhea. Looking at atopic dermatitis, pediatric infectious diarrhea, inflammatory bowel, hypercholesterolemia, interestingly, and obesity, there are kind of mixed data, and it seems like it maybe depends on how much you're giving, how maybe depends on what you're giving exactly, but less of a consensus for sure. Things to consider with probiotics if you're thinking about prescribing it. There really aren't very many safety concerns. I mean, we give them out all the time. There are similar, strains of bacteria in yogurt and in kefir, and people eat those without issue. It is worth noting that there are some instances, pretty rare, of bloodstream infection, particularly in sick hospitalized patients. So people in the ICU, people who are immunocompromised, people who are on who have a tube, tube feeding, would occasionally get infections from taking probiotics, and it might be more frequent than they would at baseline. So if you have sick patients, it may be worth considering whether a probiotic is a good choice. And then you really want to be mindful about your dose and strain, just because we know that some are effective and some seem less effective. Finally, I want to touch on ashwagandha. How many of you here have heard of ashwagandha? Okay. So it is not something that we encounter very much here in America. It is quite common in various Eastern practices. So Eastern medicine, Ayurvedic medicine, other countries elsewhere, ashwagandha is more frequently taken as an herbal supplement. In America, kind of in Western practice, we call it an adaptogen, which means that it should theoretically help your body adapt to stress and maintain homeostasis more effectively. That's kind of one of the things that it's marketed as doing. It looks like that. The supplements are usually made of the roots, sometimes also made of the leaves, but basically always have root in them. And so it comes in various doses, says things like adaptogen on it. Has a couple of indications. Now, notably, these are much smaller meta-analyses, and that has, probably some to do that we just haven't studied it quite as much as other things. Others to do that, I don't know, it's just not well accepted in Western medicine, but the science is growing. So it has been shown in a 2021 meta-analysis to have a small but significant improvement in overall sleep. They looked at numerous sleep metrics, including like quality, quantity, kind of overall subjective rating of sleep, and found that it provided an improvement over a placebo. Most pronounced in adults with insomnia, but was significant in everybody. Most effective in doses greater than 600 milligrams a day, and most effective when dosed for greater than 8 weeks. So it does seem to be effective in sleep. In terms of stress, this is kind of the adaptogen component. 2022 meta-analysis showed significant improvement in both stress and anxiety versus placebo in adults aged 25 to 48. This meta-analysis kind of suffered from low certainty due to imprecision of the trials, inconsistent kind of dosing and regimens within the trials, but it does seem like it may be effective for stress as well. Important considerations, and so this is kind of one of the things I wanted to get to with supplements. Seems to be safe in doses up to 1,250 milligrams a day for up to 6 months. That's kind of the duration that we've seen in studies. it can cause abortions. So really important if you have patients who are pregnant or who are planning on becoming pregnant, it increases your risk of having an abortion. And it's unclear whether it's safe during lactation. Common adverse effects are GI upset, like bloating, diarrhea, things like that. And then rarer, these are all kind of individual case studies of a reversible liver injury that resolved with cessation, dermatitis, similarly, hyperthyroidism and thyrotoxicosis, and then one case of penile discoloration. It is important to understand when your patients are taking these supplements because they really can have impacts and they may not have read the bottle closely enough. And since they can just buy these over the counter, knowing that supplements really can cause significant adverse effects in patient populations, important patient populations, is kind of an important consideration. And so I don't expect you to remember everything about all of this, but I do kind of want this as kind of the takeaway from the dietary supplements, that there are places that are really quite good at giving you information on indications, on safety, on dosage. NIH Office of Dietary Supplements is where I pulled a lot of this from. They've got nice fact sheets on a ton of different dietary supplements. Natural Medicines Database, similarly, I feel like they describe it in a little bit more granular detail and describe some of the smaller studies as well. And then Consumer Lab does a really nice job of comparing individual supplements too. So if you're looking at, I want to recommend fish oil, but I don't know which one, you can go there and they'll say, here are the top 10 fish oil brands and here are the best ones in terms of quality, price, etc. So as we close today, I think there are a lot of reasons to be interested in integrative health. I imagine that you guys have an interest in integrative health, and I really hope that you continue to explore that while you're here at OSU. It is great in terms of being able to offer your patient kind of whole treatment. We didn't go over a lot of modalities today, but there are, mindfulness treatment, there's movement, there's more physical medicine, there's more nutrition. They're just really great ways to kind of feel like you are serving your patient, helping prevent disease and meeting a lot of needs all at once. It's extra tools in the toolkit. I'm hoping that from this, you can take away that acupuncture has some pain indications, manipulation has some pain indications. You hopefully know what fish oil is good for, right? Cardiovascular disease. Knowing a little bit about integrative medicine can help you feel more useful, especially for patients who are struggling with finding effective treatments to really challenging diseases. And then this last point is being able to keep your patients safe, right? If you have someone who is taking ashwagandha and is planning on becoming pregnant, it's good to know that it can cause abortions. If you have a patient who has a history of like cervical spine degeneration, who wants to know, hey, can I go get my neck cracked by a chiropractor? You probably want to let them know that there are risks to that, right? So just knowing that these things exist, have many good indications, but also have some risks associated with them is, I think, an important part of trying to integrate these practices in our medical practice. So with that, I'll kind of open it up to any questions. There's a QR code here. So if you want to give feedback on these talks, we were asked to have you do that. Let me see if see the chat super well. Does anyone know a keyboard shortcut to stop sharing? Okay. Well, thank you, everyone. Feel free to ask questions. I'm just going to see if I can get the chat pulled up. Is there? Thank you.
Question. You know, had an experience with some patients or navigating situations when they wanted to pursue and bring them as treatment, but you believe like Western modality would be better. After I didn't want their kids to get vaccinated because they just.
I don't know that I've had quite so stark or intense kind of and certainly I've had people who have not been interested in getting vaccinated. I don't know that I personally have encountered anybody who has had that particular kind of struggle of trying to navigate, Western medicine versus alternative treatments. So sorry, I can't give a better answer. Yeah, I mean, I think that's a great question though, and to approach that, I think, it's all about, so much of medicine is about building trust, I think, and so it may be that you aren't going to make a whole lot of ground on the first visit. If it's like your first time seeing this patient and they come right off the bat with, I don't want any of the scheduled vaccines, I'm working with a naturopath to figure out supplements. I think figuring out what supplements they're taking and just making sure that those are safe is a good first step in trying to build trust with your patient and in working with them, understanding, because fears come from somewhere, right? And it may not be that they are afraid of vaccines per se, it may be that they just mistrust the medical system. And so being able to kind of be a contact in the Western medicine sphere for them, I think is really important. And that, over time you can hopefully kind of build that relationship enough that you can say, hey, you trust me, I trust these vaccines. Are there any that you would consider? Maybe we can't do all 3 that your child is due for, but maybe we can at least take care of meningitis, right? Maybe the scariest one for that visit, and then kind of work from there. But it's a hard thing, obviously. There's a lot of discussion that goes in, and you don't want to drive your patients away. I think that can be a big danger. It's that, if you are again someone who they feel they can't trust, then you just become another person that reinforces their beliefs. And I think that it's kind of like harm reduction, right? That your goal is just to keep people as safe as you can, even if it's maybe not as safe as you want them to be.
We want to talk about food health. It's not just about something. It's about diet, it's about sleep, it's about activity, all the things that you put. And maybe that already happened in the consult.
Yeah.
So talk a little bit about your experiences with auricular acupuncture and the patients at the free clinic. What did you most often use auricular for?
So a lot of it is kind of exposing patients. I think a large value of the acupuncture clinic at CFC is an opportunity for students to get their hands on needles, kind of an other opportunity to treat patients in a way that isn't kind of, I feel like CFC can be a lot of kind of like shadowing a physician or shadowing an older student. And so this is sort of a way that you can do a procedure that is very safe and feel like you're providing something to the patient. So a lot of times it wasn't even necessarily trying to treat a given condition. It was simply saying, have you ever tried acupuncture? Would you like to try it? It's free. It's not going to hurt you. And so you can kind of build a relationship of trust with the patients there, create a positive experience at CFC, and also kind of show them that, okay, there are these other treatment modalities that when used effectively with Western medicine can be effective and aren't scary, right? A lot of the people that you approach about trying acupuncture are like, oh, I'm not a big fan of needles. Like, I don't want to do it. I don't like needles. But if you can get them to even try one ear and they see that it really doesn't hurt, it's not that scary. I feel like you kind of open up this world that they thought was closed. That may be too grand and putting too much to it. But I do think it's helpful for patients to kind of get that perspective. There's also like calling music, and we used to have tea. And so it was just like a really nice experience for everyone to kind of like have a calming sit down in a stressful environment. So Yeah, Jody.
You said you did some, OMF, like, did you do one of the classes at Dublin?
So I have not taken a course at Dublin. I think I missed the most recent one, which was in the fall. I took a class at one of the family medicine conferences. And we've had the Ohio Health Dublin family medicine residents come here a couple of times to do osteopathic workshops. And so I've done that a couple of times. So I've had a few opportunities to try it. And I'm hoping that we can continue to kind of do that mix of things of like having them come here to do workshops, being able to like go out there. I know they also, at some intervals, they do like kind of get-togethers of all of the osteopaths to kind of go over data and kind of new modalities, and they'll bring in speakers. And so I've been to that, and there was kind of like an hour of just like trying out manipulation and working with the residents, and they're all super friendly. So they'll be like, oh, you want to try it out? Like, here's how you do it. And so, yeah, just cool opportunities to learn how to do it, even though, you know, I don't have a ton of experience outside of that. Well, that's about it. And I'm sorry if there's anyone on the Zoom. Oh, there we go. Okay. Great. Okay, well, with that, thank you all for being here. I really appreciate it. If you have questions or concerns, I hope you don't have too many concerns. You know, feel free to ask. You can email me, you can come up and chat. We also have other like resources and PowerPoints that kind of do a more like broad coverage of this kind of stuff. So if you're like, what are some of the other treatments, we can send out resources like that too, that aren't quite so granular as this one was. So thanks, guys. I really appreciate being able to talk with you.